Most strokes don't come with a loud warning. Did you know that some of your most normal habits could be quietly putting you at risk of a stroke? Especially for seniors, strokes don't always come with a dramatic warning. They build up slowly through small things we do without thinking. In this video, we will walk you through 5 common habits, like certain eating patterns, sleep routines, and even how you manage stress, that might be raising your risk without you realizing it. Watch the video till the end and regain control of your life. Habit 1. Sitting too much. We all enjoy a good rest, whether it's watching TV, reading a book, or sitting after a long day. But did you know that sitting too much can quietly raise your risk of stroke? Here is the science. When you sit for long periods, your blood flow slows down. This makes it easier for fatty acids and cholesterol to build up in your arteries. Over time, this buildup, called plaque, can narrow or block blood vessels that carry blood to the brain. If a clot forms and cuts off that blood flow, it causes a stroke. Prolonged sitting also reduces the body's ability to use blood sugar and fats properly. This raises your risk of high blood pressure, obesity, diabetes, and high cholesterol. These are all major stroke risk factors. Your body is a machine, and when it's inactive for too long, systems start to clog, slow down, or misfire. And here is something surprising. Studies show that even people who exercise once a day are still at risk if they sit too much the rest of the time. It's called the active couch potato syndrome. So, what can you do? You don't need to join a gym. Just stand up every 30 to 60 minutes. Walk to the kitchen. Do a few arm stretches or leg raises. Try doing some light housework or taking a short walk outside. These small movements help improve circulation, keep your blood vessels flexible, and reduce clotting risk. Your brain depends on healthy blood flow to stay sharp and protected. By simply sitting less, you are giving your body, and especially your brain, the best chance to stay strong and stroke-free. Habit 2. Eating processed or high-sodium foods. Processed foods are sneaky. They are quick, tasty, and often feel harmless, especially when you are just adding a little ketchup, heating a frozen meal, or snacking on a few crackers. But behind the convenience lies a hidden danger: excessive sodium. High-sodium diets are one of the biggest contributors to high blood pressure, which is the #1 risk factor for strokes. When you consume too much salt, your body holds on to extra water to try to dilute it. This added water increases the volume of blood in your bloodstream, which puts additional pressure on your blood vessels. Over time, that constant pressure tires your arteries, making them stiff, narrow, and more likely to get blocked or burst, leading to a stroke. Processed foods are packed with sodium, even the ones that don't taste overly salty. Canned soups, frozen dinners, deli meats, cheeses, sauces, pickles, chips, and even some breakfast cereals are loaded with salt to extend shelf life and enhance flavor. What is worse is that most people don't realize they're going over the recommended daily limit of 1,500 to 2,300 milligrams of sodium. The solution isn't cutting out all salt forever. It's about being more mindful. Start reading food labels. Cook fresh meals at home using herbs and spices for flavor instead of salt. Swap out processed snacks for fruits, unsalted nuts, or yogurt. By reducing your sodium intake, you are directly lowering your blood pressure and protecting your arteries. That means less strain on your heart, better circulation, and a much lower chance of suffering a stroke. Habit 3. Smoking or exposure to secondhand smoke. We all know smoking is harmful, but when it comes to strokes, the risk is even more serious than most people realize. Whether you are a long-time smoker or simply around others who smoke often, the effects on your brain and blood vessels can be devastating. How it works is that smoking damages the inner lining of your arteries, making them narrower and harder over time. This limits blood flow to the brain and increases the chances of a clot forming, which is one of the leading causes of stroke. Smoking also raises blood pressure, lowers oxygen levels, and increases the amount of sticky substances in your blood that promote clotting. And it doesn't stop with direct smoking. Secondhand smoke, which is breathing in smoke from others, can have the same damaging effects. Studies show that people regularly exposed to secondhand smoke are at a 25 to 30% higher risk of stroke, even if they have never lit a cigarette themselves. For seniors especially, these risks add up. Years of exposure, even if it's casual or only social, can cause long-term damage to your blood vessels and heart. But it's never too late to quit or protect yourself. Once someone quits smoking, their stroke risk drops significantly within just 1 to 2 years, and if you don't smoke but live with someone who does, gently talk to them about quitting, or make your home and car smoke-free zones. Your brain needs clean blood and strong arteries to function at its best. By avoiding smoke, you are giving yourself the gift of clearer thinking, healthier lungs, and a longer stroke-free life. Habit 4. Poor sleep. Less than 6 hours or inconsistent. Sleep is one of your body's most powerful tools for healing and repair. And when sleep is poor, short, or irregular, your brain and heart can suffer quietly in the background. In fact, getting less than 6 hours of sleep per night has been linked to a much higher risk of stroke, especially in older adults. Why? Because poor sleep disrupts the body's natural rhythms and recovery processes. When you sleep, your blood pressure drops, your heart slows down, and your body resets. But if sleep is cut short or happens at odd hours, those systems get thrown off, and you are left with chronically high blood pressure, increased inflammation, and higher levels of stress hormones, all of which increase the chance of blood clots and stroke. Inconsistent sleep patterns, like going to bed at 10 p.m. one night and 2 a.m. the next, also confuse your body's internal clock, affecting everything from hormone release to circulation. Over time, this increases the risk of conditions like atrial fibrillation, which is another major contributor to strokes. For many seniors, sleep gets harder with age. Pain, stress, medication side effects, or habits like late-night TV or caffeine can all play a role. But making minor adjustments can help. Try going to bed and waking up at the same time every day, even on weekends. Create a proper bedtime routine, limit screen time before bed, and avoid heavy meals or stimulants late in the evening. Prioritizing quality sleep is one of the most underrated ways to protect your brain and heart. A well-rested body is better at managing blood pressure, fighting inflammation, and staying strong against stroke risk. Habit 5. Ignoring high blood pressure. High blood pressure is often called the silent killer for a reason. It rarely shows symptoms, yet it quietly causes damage deep within your body. For seniors, this makes it especially dangerous. You may feel perfectly fine, but inside, your arteries could be under severe strain. When blood pressure stays elevated for a long time, it puts constant force on the walls of your arteries. Over time, this pressure weakens and damages them, making the blood vessels more likely to narrow, clog, or even burst. If one of those damaged vessels is connected to your brain, the result could be a severe stroke. What makes high blood pressure so risky is how easy it is to ignore. Many people assume that if they're not feeling dizzy, lightheaded, or ill, then their blood pressure must be under control. But that's not always true. Some people live for years with dangerously high levels without realizing it. A healthy blood pressure should generally stay near 120/80. And readings consistently above 130/80 are considered high. The longer it's left unmanaged, the more damage it can do. The good news is that blood pressure can be controlled through small, steady changes. Reducing salt intake, walking daily, managing stress levels, and, if necessary, taking medication as prescribed can all make a big difference. But ignoring it, hoping it'll go away, or only checking it once a year is not enough. Keeping an eye on your numbers and taking them seriously could mean the difference between a strong, independent life and one affected by disability after a stroke. When to talk to a doctor. There is a common belief among many seniors that if something doesn't feel serious, it's better not to bother the doctor. But when it comes to stroke prevention, that mindset can be dangerous. A stroke doesn't always give you a clear warning, and by the time obvious symptoms appear, the damage may already be done. That is why understanding when to talk to a doctor is one of the most important steps you can take for your long-term health. For example, if you have been feeling more tired than usual, have noticed occasional dizziness, or have moments of blurred vision or slight confusion, you may dismiss these as signs of aging. However, they could be signs of rising blood pressure, circulation issues, or even small unscanned strokes. Similarly, occasional numbness in your limbs, difficulty speaking clearly, or sudden mood changes may seem random, but they can indicate your brain isn't getting the blood flow it needs. Even if you're not feeling unwell, it's essential to schedule regular checkups. A doctor can monitor your blood pressure, cholesterol, blood sugar levels, and overall heart health. These are all factors that directly affect your stroke risk. Routine visits help catch problems before they turn serious. For people with a family history of stroke or heart disease, these visits become even more critical, as your baseline risk may be higher than average. It's also wise to speak to your doctor whenever you plan to make any lifestyle changes. Starting a new diet, quitting smoking, or increasing your physical activity are all great decisions, but your doctor can guide you on how to do them safely and effectively based on your health profile. More than anything, your doctor is your partner in prevention. They can provide clarity, reassurance, and a personalized plan fit to your needs. Reaching out doesn't mean you're overreacting. It means you are being responsible. And when it comes to something as serious as a stroke, it's always better to speak up sooner rather than later. If you found this video helpful, don't forget to like, subscribe, and tap the bell icon so you never miss a tip that could save your life. Stay informed, stay healthy, and we will see you in the next one.